Good afternoon. My name is Adisha Dowe-Sylvester and I am the primary nurse on the unit. I am here today with the staff to talk about fall measures and preventions for patient Zoon. The Morse fall scale for patient Zoon is the score is 95. Patient has not had a history of falling. Patient has secondary diagnosis of dementia and pulmonary hypertension, and an ambulatory aid, which gives this patient a score of 15. The ambulatory aid is the walker. Under number 3 asked about the walker, and the score was 15. Furniture, the score was 30. Patient has impaired unsteady gait, which the patient scored a 20. Under mental status, the patient overestimates and forgets limitation. The patient had a score of 15. Altogether, the score was 95, which makes the patient very high risk for falls. So the staff members and I were speaking about Zoon and what are the best actions to be taken. Zoon is a 65-year-old male admitted to the hospital for urinary tract infection and has not responded to oral antibiotic therapy. Client is oxygen dependent due to a diagnosis of pulmonary hypertension. He also has dementia. Patient was going to the bathroom assisted by his daughter and sustained a fall. Nurse observed him on his right hip and pain noted. X-ray of the right hip was ordered and revealed a right hip fracture. Ortho consult and morphine was ordered for pain. The unlicensed assisted personnel said he would monitor the patient's vital signs, keep the area clutter-free, and make sure the bed is in the lowest position. When the client is getting up, allow him to dangle his feet before standing. If the patient has a problem when standing, put the patient back sitting down in the bed until the patient is able to stand. The charge nurse would make rounds with staff on every shift to observe what patients are doing or where they are located, having weekly meetings to discuss fall prevention measures. Nurse manager will maintain adequate staff on the unit. If staff is limited, reach out to agency personnel for assistance. Replace staff when needed and offer per diem and fee-for-service positions. Provide contracts with several nursing agencies. This will help with having adequate staff on every unit. Physical therapy. Check the patient's equipment on every shift to prevent falls due to faulty devices. Let the patient re-demonstrate how they use the device. If the patient cannot use the device properly, continue to teach the patient how to use it until they are able to use it properly in order to get to the bathroom. PT will provide gait stability, endurance, ambulation, balance, functional status, range of motion, and home exercise programs. The patient will not get out of bed, said he would not get out of bed without assistance. The call bell will be turned on and he would wait for help. The family says in the event the nurse does not respond, someone will go directly to the nurse's station. Then if no one is available, she would move the furniture, check the bathroom for spills and uneven surfaces. Then assist her family member with the walker and have a chair close by in case the patient gets tired or their feet buckle under or they experience weakness. In the leadership and interprofessional qualities that I found with this assignment, teaching the team members was about fall prevention was the most adequate. This can be done individually and as a group. Individually, in order to get a clear grasp as to what the staff member knows about fall prevention and measures. As a group, in order to understand what you can do as a group in order to prevent fall prevention. Because you cannot take into consideration, you have to take into consideration that everyone is different and also they are at a different level where fall prevention and measures are. Some people don't know what to do. Some people know more than others. Some people know some things but they never had it implemented and so forth. This is why we have to discuss things individually and also as a group. Thank you.